Knock, knock.
Hello.
Hi, my name is Violetta. I'm going to be doing a head to toe assessment on you. I'm
Okay.
going to check your band here. Can you state your name and date of birth?
Michaela Lumley, April 14th, 1997.
Perfect. Both of those identifications match. Okie dokie. And then we're just going to closing the curtain, providing some privacy. Patient is safe on the bed. Feet are dangling. Everything's golden. Alright, so I'm going to ask you a couple more questions. Do you know where you're at?
I am at Mid-America Nazarene University.
Perfect. And do you know who the president is?
Donald Trump.
Perfect. Patient is alert and oriented, ×4. Patient's posture seems erect and calm. Her facial expressions are appropriate for situation. They're also calm and pleasant. She's able to smile. She seems to have proper nutrition, seems well groomed, well kept, so good hygiene, no odors detected.
Thank God.
She showered today. And her mood seems appropriate for the situation. I don't know if I already stated that, but I will. Okie dokie. So I'm just gonna look at your skin here. Stick out those arms. Cool. My hands are really cold.
Yeah.
I have already done my hand hygiene. I just washed my hands, by the way. All right. Skin seems bilaterally warm, slightly dry, which is okay for this situation. No lesions.
There is a group that has this room reserved starting at 1 o'clock.
Okay.
Okay, so just so you know that there is, now there's limited space upstairs on this side of the building. They've got the other rooms all reserved.
Okay.
If you need a place and the other rooms are all taken, we can put you back in the computer lab.
Okay, we'll be
All right.
done by 1.
That's okay, just want to give you some warning, instead of
Okay.
having a whole bunch of junior high kids all of a sudden show up on your doorstep.
Okay,
All right.
thank you.
You just keep going. Just
Okay.
keep going. Just run with it. Yep.
Excellent. And cut. All right. Yep. Skin is bilaterally warm, slightly dry. No lesions, no edema. Face doesn't appear to have any edema. No obvious physical deformities. I'm going to check your capillary reflex. Wow. Refill. Cap refill is brisk, less than 3 seconds. Nails, no striations, nice and smooth, ooh, really well kept, and I'll have you do this little tiny heart. All right, patient has the little slit in the middle, so that means no clubbing, which is what we want. Okie dokie, so now I'm gonna do the head assessment on her. Testing, looking at her cranium from any lumps or bumps or any deformities. Everything seems symmetrical. Hair is very beautiful. It is nicely distributed. No patches noticed. It doesn't appear that she has any pests. Thank goodness for that. And she doesn't appear to have any dandruff, so she is good. She is normal cephalic. Alright, and then I'm just going to take a look at her ears. Both the ears seem bilaterally aligned, no crust, no lesions, ears intact. That's great. And I'm going to do a whisper test, so I'm going to have her face the camera. And whatever I whisper into her ear, she'll whisper back and she'll tell me which ear she heard it from.
Skittles. Vegas.
Perfect. All right, so patient passes the whisper test, and that is testing her ocular motor nerve, so she can hear A-okay. Okie dokie, so now we're gonna, I was looking for my headline, there it is. All right, now I'm gonna just check her pupils, which if I hold it the right way, I'm doing the corneal light reflex, and she's got that twinkle in her eyes, same position, perfect. Her eyes appear white in the sclera, iris is consistent with her color, which is greenish blue, and I'm just going to pull down on your eyelids. And conjunctiva is pink, no signs of infection, which would be red. Her face is symmetrical, and I'm going to test her pupils. Gotta look at the light, man. Pupils pupils constrict, we would call that perla. So that's golden. And now I'm gonna test her visual acuity. So I'm gonna have you cover up her eyeball, and I'm gonna hold in 4 different quadrants a number, and you tell me which one it is.
5, 2, 2, 1,
Perfect. And then cover the other eye.
2, 1, 5, 4.
Perfect. Visual acuity seems pretty normal. And I'm gonna have you look at my finger and you'll follow it for me. We're doing the 6 cardinal gaze. And follow it. All right, EMOs are intact. No nystagmus noted. Perfecto. And there's another test that I'm doing, but I don't know what I'm doing. Okay, well, anyways, we're good. All right, so now I'm gonna palpate her frontal and maxillary sinuses. Just let me know if you feel any tenderness, okay? My hands are freezing. All right. Patient states no tenderness and they are non-palpable. And I'm just gonna feel your lymph nodes. So preauricular, perfect. Postauricular, perfect. Occipital, and submandibular, beautiful. Patient states no tenderness and lymph nodes are not palpable. Okie dokie. I think he's from the other mod.
Just They're not here.
And then I'm gonna have you occlude one nose, breathe out, other nose. Awesome. Nares are patent bilaterally, doesn't have any trouble breathing. All right, and we're gonna check her mouth. All right, so lips look pink and moist. So I'm gonna check inside and say ah. Stick your tongue out. All right. The tongue erects midline and uvula. Say ah. All right. Uvula rises symmetrically, and then I'm gonna check your inside of your cheeks, and then lift up your tongue. Smile. All right. So everything's pink, warm, and moist. Well, actually, I don't know if the inside of your mouth is warm. I'm guessing so.
God, I hope my teeth are pink, warm, and moist either.
But her teeth are white, intact in the gums. The flora of her mouth is intact, and her tongue is pink and rough, which is normal.
Woo!
Elderly patients should be soft and flat. Alrighty, so I'm gonna go and palpate her carotid arteries. Ooh, nice. That'd be a +2 on the left side and a +2 on the right side. Yeah, okay. And now I'm gonna have you go touch your chin, neck, and then upwards, and then ear to shoulder, and then ear to other shoulder. Perfect. And then we'll do range of motion. So I'll have you actually look this way, that way. Perfect. Do resistance, go. Alrighty. Neck muscles are at a 5 out of 5 with resistance and without resistance. Gotta breathe.
I know, you're rushing this. You're good though.
Alrighty. Everything seems to be checking out. Oh no. Coming in. Hey. Alrighty. And I am going to listen to your hard sounds.
Okay.
Alright, so I'm gonna palpate for the apex,
Okay.
the apical pulse. Alright, that's found in mid-clavicular line at the 5th intercostal. Gonna auscultate it. I'd do this for a minute, but you know, with time. But I hear normal heart sounds. And now I'm gonna listen to 1, 2, 3, 4, 5 different points.
She's got it.
All right, and I'm gonna switch to my bell and listen for any heart murmurs. Alrighty, heart sounds are normal. No heart murmurs heard during auscultation. Alrighty. And now I'm gonna check your radial pulses together. Alright, radial pulses are +2, so that's golden. Alrighty, so now I'm gonna listen to your heart sounds and then we'll check your muscles down below here. What? Yeah, sorry, lung sounds. I was like, what? Alright, take a deep breath for me. Breathe in through your nose, actually.
I know that.
And in through your nose. And do it again. That sounds pretty cool. Ow, that hurt. And then I listen to the lower one. And do it again. And raise your right arm up. Listening to the 3 different lobes in the right lobe. Perfect. Lung sounds are clear in auscultation, bilaterally, no abnormal breath sounds. Alrighty, and now I'm going to count respirations. Just listen there. Alright. You know what's up?
Yeah, respiration.
Well, respirations would be normally 16 to 18 per minute. Alrighty, and we are going to listen to you when you bend over. Perfect. Take a deep breath with me. Alright, perfect. Everything seems clear on auscultation. And we're just gonna check out those hand muscles. So I'm gonna have you grip.
Yeah.
Perfect, 5 out of 5. And then I'm gonna have you flex for me, and then you're gonna extend for me. Alright, and then do some resistance, and then push against me. Awesome sauce. So patient's upper extremities are a 5 out of 5, with resistance and without resistance. Now I'm gonna auscultate the back side of her. I'm just gonna listen to those lungs again, but first I'm gonna do the kidney palpation. So let me know if you have any tenderness when I do this, okay?
Nope. Nope.
Alright, and then I'm gonna have you take a deep breath. Perfect. Patient has bilateral expansion when she breathes. And listening to the lung sounds. Take a deep breath. Alright, deep breath. Perfect. Deep breath. Deep breath. Deep breath. And deep breath. Alright, lung sounds are clear on auscultation. And her shoulders, right now from looking at the back, are symmetrical. I'm gonna have her bend forward and I'm gonna ensure her safety here. Alrighty, her spine appears to be in line and no deviations. And I'm just gonna palpate these spinous processes and they seem to be intact all the way down. Perfect. Alrighty, you can sit back up for me. Alrighty, so everything's looking good there. Cool. Now I'm gonna have the patient lay down. And I'm gonna We'll first inspect her tummy. It does. It's just so cold. All right. Patient's stomach is flat. It's soft. Umbilicus is midline, symmetrical. No lesions or anything weird like that. It looks like she's had surgery before. All right, now we're going to auscultate all 4 quadrants of the abdomen, starting with the lower right abdomen. Listening for 15 seconds. And if that wasn't 15 seconds, we're going to pretend that it was. Seems like patient's hungry still. And that would be 15 seconds as well. Alright, 15 seconds, and now to the lower left quadrant. And now I'm going to listen to the aorta. Alrighty, patient has hyperactive bowel sounds in all 4 quadrants. If there was no activity in her quadrants, we would listen for an extra 5 minutes to ensure that there are some bowel sounds. And no bruise noted in her aorta when auscultated. So everything sounded good on auscultation. Now I'm going to do some light palpation. Yes, light palpation. All right, so my hands are really cold. And patient will tell me if she feels any tenderness at any point in time, so we can stop the process right there. All right, ready? All right, tummy seems soft, and now we're going to do deep palpation, which is 2 centimeters deep. Perfect. Everything's checking out good. Not feeling any abnormalities. Everything is nice and soft. Perfect. Cool. And now we're gonna do the palpation in each 4 quadrant. Percussion, percussion, percussion. These students out here. All right. In all 4 quadrants, the abdomen is tympanic. Awesome, and we can put down your shirt. Perfect. And I would percuss her liver, but not right now, because it's not needed. Alrighty. Now we are going to check the patient's lower extremities. Cool, cool. I mean, her skin is not cool. It is actually warm, slightly dry, intact, and no edema is present, no varicose veins, no lesions, no funkiness. So everything's bilateral. Now I'm going to palpate her pulses on her dorsalis pedis, right up on the extensor below the big toe. She's got a pulse of +2 on the right and on the left. Bilateral, good pulses. And then feeling the posterior tibialis on both her legs, and those are a +2. She's looking good, and now we are gonna do some flex and extend.
Okay, you've got like 4 minutes.
We've got this.
Yeah, you got it. I should probably shut up.
Alrighty, so I'm gonna have the patient bend her knee up, both of them perfect. I'm gonna have her flex outward, and then up to the sky. Whoa, we're gonna make sure she does not roll off the table today. During patient safety. All right, and then we're gonna do some resistance. So do your knee, perfect, and knee, awesome. And then try to kick upwards, perfect, perfect. And now I'm gonna have you do laying down fire hydrants. All right, with your left one. And then your other one. All right, and then we'll do with resistance. Alrighty, and then come here around here. Don't roll off the bed. Okay, and then I'm gonna have her do dorsiflexion. Beautiful, beautiful, and then plantar flexion. Cool.
Oh,
All
yeah.
right, and then she's gonna do some resistance on her feet muscles here. Go up. Yeah. And then down. Yeah. Patient has a 5 out of 5 for her lower extremity muscles without and with resistance. Alrighty. Well, overall, my patient seems healthy, well maintained. She's awesome sauce, and yeah. Okay, cool. Woo! Give me an A.
Yeah.